Good afternoon, sir. How are you today?
Doing good, Matt. How about yourself?
I'm doing well. Thank you for joining me today on the Meat Wagon podcast. Ladies and gentlemen, today we have the illustrious Kade Jarvis with us, a salesman extraordinaire for Pinnacle Ambulance, also an EMT. And I'll just turn it over to you. Tell me a little bit about yourself. What's your career path been like, and any kind of life events that you'd like to share with us?
Sure. Yeah. So as Matt said, my name is Kate Jarvis. I've been in EMS myself for a little over 5 years now. Went to EMT school during college, and that's what I did as a job during college to help pay for the tuition. I've always kind of been in EMS my whole life. Both my mom and my dad. My dad is a paramedic. Mom was an EMT. They actually met when my mom was doing ride-alongs for her EMT school, which is really funny. Um, and then throughout my life, my dad was always as a paramedic, kind of filtered between full-time and part-time, like a lot of people do. And then eventually got started in the ambulance business in the early 2000s. So there was an ad in the back of an EMS newspaper. Wheeled Coach was looking for an ambulance sales rep in Western Missouri. And so my dad called, got that job in the late 90s, and we've been doing the ambulance thing ever since. So worked for Wheeled Coach all the way up until 2014, and then started Pinnacle after that to go out on his own, start his own business. At the time, we were representing Braun ambulances in Missouri and Kansas. And then since then, obviously it's 2024 now, so we've hit our 10-year anniversary, or will, in the next 2 weeks. Now we've got Braun, Demers, and Crestline across Missouri and Kansas, like we started with, but also in Arkansas and Oklahoma. So within Pinnacle, I live in Columbia, Missouri, right in the middle of the state, and I do sales for Missouri as well as the eastern half of Kansas.
That's fantastic. So, what's that? What's that drive like between Columbia and Arkansas? Is it a regular thing for you, or do you do a lot of
It's
pub stuff?
Yeah, it's definitely regular. Whether I'm down there to meet customers, do deliveries, it's about a 4.5 hour drive from me, and I would say it's at least once a week that I'm making it now, which is part of the deal. I would still not trade it for anything because being handling Missouri, living in Columbia is the perfect place. Anywhere I need to go is mostly a day's trip, never more than 3.5 hours to anywhere in the state. So my wife appreciates that. Always usually back home every night.
Uh,
Yeah,
well, just so happens that we use you, and we really enjoy the ambulances that we get from you.
appreciate
So,
that.
you mentioned the 10-year anniversary. Tell me a little bit about that.
Yeah, so next week, actually, next Thursday, September 26th, we're having our 10-year anniversary event at a hangar right by our shop. Um, Food, drinks, giveaways, all that fun stuff. But we're also having a few really cool ambulances on display. So Demir's last April officially unveiled they're calling it the EFX is the model name, and it's a fully electric ambulance. The electric part is cool. Perhaps the coolest part, actually, though, is how they completely redesigned the patient module in the back. Utilizing the electric chassis platform opened up a lot of possibilities that aren't feasible right now whenever we're given, a Ford chassis is only so big and so wide, and that's what we mostly build on.
Hmm.
So it's a completely redesigned ambulance, the Demers EFX. So that's going to be down at our event alongside some current ambulances. We've got Bronze and Crestlines and other Demers that are going to be there. And then we're also having a early 70s Cadillac Miller Meteor parked alongside it, which should be a pretty interesting dichotomy, having the EFX parked right next to that classic ambulance from the 70s. So we're looking forward to that for sure.
That is cool. Yeah, we're looking forward to attending. Scott and I will be coming down to pick up our remounted ambulance from you,
Yeah.
and just booked our room today. I was surprised at the range of prices for hotel rooms in Benton.
Yeah. The I think the LPGA tournament is happening that weekend, so that's eating up a lot of the hotel space, I'm sure.
I bet. Yeah, I think
One
it
of
was.
those things you book the event space, you plan the date, and then okay, there's also that happening the same weekend. All right.
I think it
It's
was Embassy Suites was nearly $500 a room per
uh,
night.
I believe it. Yeah,
little steep for my blood.
for sure.
So your parents obviously had a background in EMS, and did that passion get transferred to you genetically
Definitely.
by observation?
Yeah, yeah. Nature or nurture, I don't know. But yeah, it definitely. And I always grew up just going to the station. Having lunch with dad whenever he was in and not running calls and things like that. So I've always kind of had it in my blood. Shortly after I started college, I kind of really grew to liking the ambulance business side of things. And really, my parents encouraged me that if you want to do the role that I'm doing now, you're well served to actually work on the truck. There's a lot of people, most people in the industry that we're in now don't. They start out in car sales or something like that and kind of transition over to the specialty side in ambulance. But it's been a huge benefit to me having can say that I've worked on the truck. When I'm sitting down with customers, we're designing layouts, we're talking about where things need to go. Having worked on the truck is just a huge benefit and something that I wouldn't trade for anything.
Yeah, absolutely. I could see the huge benefit from a design standpoint.
Mm.
'Cause if you've never been in the back, designing one from scratch would be kind of a challenge.
Definitely. Yeah.
Um, so what kind of design changes have you seen over the years that have been most impactful?
Yeah. So starting from the beginning, really the squad bench, CPR seat, attendant seat at the head of the cot has kind of been the standard ambulance layout for going on 40 years now, really ever since the modular ambulance became a thing. And that design is there's been a few changes, more cabinetry, things like that, but for the most part, that's what everyone's been using for, like I said, 40 plus years.
Mhm.
Um, I'd say around the mid 2010s, you saw a lot of people adding a attendant seat where the squad bench used to be on a track that swiveled. So you'd move up towards the head of the patient, rear towards the foot of the patient. You could lock facing forward in the seat, or you could pivot and be facing sort of a 90-degree angle right at the patient. And that was a pretty popular option for a few years, and we still have a lot of customers that do that. The downside is there's a lot of learning when it comes to that. And as you know, most people in EMS don't just work at one place. They usually work at a couple different agencies. So if one agency uses all pretty standard trucks with squad benches and things like that, when they transition over to a truck that has what we call a mobility seat on the side, it's almost like they're having to relearn it every single time because this lever moves you forward, this lever turns you sideways, this lever may move your seat back. There's a lot of learning with that. um, and so there's pushes and pulls. Generally, the people who've been in EMS a while don't care for it, and the newbies are fine. They haven't learned anything else. So,
Yeah.
uh, and that's where the EFX is design in the back, which you'll get to see next week, is very different in that it accomplishes that same goal of keeping you buckled in with full access to the patient head to toe, but it takes away a lot of those pain points that the current system we have has.
Yeah. I really did like the design. It looks very futuristic, but also very ergonomic, and it makes sense the way it's laid out.
Right.
So, talk to me a little bit about safety. I know safety is a big thing for us. One of our two pillars is that everybody goes home safe after their shift.
Mhm.
So, what do you guys do as far as safety testing or designs that increase safety?
Yeah, so we kind of look at it two different ways. The first part of safety when we're talking about ambulance design is how are you actually building the ambulance, not necessarily how it's laid out on the inside. So, what materials are you using? The majority of the industry today, I'd probably say 70% plus of the ambulances you see on the road are all wood interiors. So they build their aluminum box, then they build their wood cabinets just like you would in a kitchen. And you put them together, and that forms your cabinetry, that forms your squad bench, everything you see inside the truck. What we really believe, and what all of our brands believe, is that aluminum is a more superior product. Tends to be lighter weight, tends to be stronger. The downside is there's not as much flexibility with it in terms of layouts, but we think from the safety aspect, having a fully aluminum truck um, serves itself well if you were to get into an accident, things like that. We've all seen the pictures online of ambulances that have wrecked, and unfortunately, some of them completely come apart. So that's the first part, is making sure that your box is strong, both from the exterior and on the interior. Um, the second part of safety is, of course, just how's the truck designed? Is it ergonomic? Am I able to be seat belted as much as possible? Is everything within arm's reach? Because even if it's not a catastrophic accident, if it's a front end collision or a sudden braking and it sends someone flying in the back of the ambulance, the more you can have them buckled and the more safety aspects of head padding and nets you can, um, all of that just continues to help to, achieve that mission of sending everyone home at the end of their shift.
Yeah. Yeah, I really do see the difference in those boxes, especially. I mean, I haven't been in EMS for too very long, but a couple decades now, and the design changes have been significant from when I started. So I don't know if it's because I am in an echo chamber, just getting a bunch of national emails, but I sure do see a lot of accidents.
Mhm.
What are you seeing from your point of view as far as accidents across the country?
Yeah, definitely up, and there's a lot of reasons for that. I think phones are probably a big one. But you'd think a big vehicle with lights and sirens on it would be the least thing that could get hit on the road, and it tends to be the opposite. And there's accidents that happen even when they're not running emergent, even when they're just running to the gas station to grab a drink. It happens all the time. So whatever we can do from an ambulance design, ambulance manufacturer side of things to provide the most safety in the back of the box is what we always try to do. Like I said, from a construction of the box standpoint, and also the layout on the interior.
Yeah. We really appreciate the cameras that you put in the back patient area and then the backup camera as well. We also add through Verizon Connect, we add another camera up front. It has the ability to be inward facing and outward facing. We currently don't have the inward facing camera on
Mhm.
because we kind of want that to be a safe space for the crew to kind of complain and bitch and moan, so to speak.
Right.
But it does have a forward facing camera, and it anytime there's a hard braking incident or fast driving or an impact, it will record a period of time before and a period of time after, kind of save that snippet in case you need to go back and look to see
Right.
what happened. Do you guys have any plans in the future of maybe partnering with a similar company to add that in to your builds?
Yeah, and a lot of times we do that based on what the customer needs. We use there's a lot of different systems you can use. Brigade, Zone Defense are a few of the most popular ones that get you that 360 recording capability.
Hmm.
Um, and so we certainly use those and then partner with customers depending on what they need. Hoss Alert is one that's pretty popular now that gives people using Apple Maps or Waze alerts that there's an ambulance ahead of them. Which is anything you can do to try and keep people's heads up and keep them on a swivel is definitely always a good thing.
Yeah. You mentioned earlier lights and siren. I've seen a paradigm shift within the industry of less and less use of lights and siren. You
Mhm.
see that as well from your point of view?
Definitely, yeah. A lot of times, especially a lot of our business now is interfacility transfer trucks that aren't necessarily, unless they absolutely have to, are never going to be used on a 911 call. Most of those are going to be hospital to hospital, hospital to nursing home, hospital to patient home. So you're not running emergent most of the time. So like I said, those trucks may never have their lights or sirens turned on besides just to check and make sure that they work. The other thing that we're doing that Demir's is moving to, and actually all of our brands are moving to very soon, is they put a photo cell on the side of the truck. And so whenever it's dark, they will actually dim the lights on the truck because when it's bright out, you want those lights as bright and flashing as fast as you can. At night, that can really create a chaotic environment, both for those working the crew and also people just driving by if you're on the side of the
Mhm.
roadway. So, dimming the lights, slowing down the flash pattern, trying to keep it a little bit more calm is something that they're moving to as a standard in the industry, or at least with the brands that we're using. And I think that's definitely a good thing. Talking like what you were mentioning, we're not using lights and sirens on every single call anymore.
Mhm. No, and I think we this last year we ran some data reports, and I think we're at about a 70-30, 75-25 split
Hmm.
between using lights and siren and not, at least the reporting software anyway. don't know how accurate it is. The person, when they're doing their chart, has to document it. If it's, I don't know if that's super
Right.
accurate. Well, that's awesome. And we sure have seen the technology kind of go up quite a bit. So speaking of things going up, everybody wants to talk about price, right? So what are you seeing as far as industry trends?
Yeah, I would say really about 2 to 2.5 years ago was whenever the price spikes really started. And I can go back and explain kind of why that happened if
Feel
you.
free, yeah. Yeah.
Yeah, so everyone knows COVID. We got hit, all the ambulance manufacturers got hit with COVID just like everybody else. Really, I'd say for the first 6 to 8 months, not a whole lot changed. Orders were still coming in. Maybe a couple shifts would have to go home a little early if they had a few people out and couldn't do all that they needed to do. But a lot of our manufacturers went to split shifts, so they'd have a day shift and a night shift just to be able to keep, a big bulk of people not being in the factory at the same time. Um, However, the chassis manufacturers slowed down the amount of computer chips that they were ordering, the chip shortage, because they anticipated no one's traveling, no one's going to be buying as many cars, things like that. Um, because of that, we were not getting the chassis that we were ordering. So, if we, for example, let's say we just ordered 100 F450 4x4 chassis from Ford, we would get 12 to 15 of them. The rest of them would be canceled and we'd have to reorder the next model year. Well, that price, of course, goes up. However, the whole time we're still taking orders on the ambulance side of things. And a lot of times people are panic ordering. They're saying, oh, we might not even get these 3 trucks that we order, so let's just order 5. And so that whole lead time when we're not building trucks, but our orders are still coming in, our lead times are pushing out. It started out at, maybe took 5 to 7 months to get an ambulance. Well, then it went to a year, and then a year and a half, and then 2 years, 2.5 years, and I know there's brands out there that are 4 years out today,
Yeah.
even longer if you look on the fire side. I mean, so really the lead time is what caused the pricing to do what it did. Because how do you price something that you're not going to build for 3 or 4 years? I don't know. Inflation could hit like we had a number of years ago. You never know. So I think a lot of the manufacturers are just aiming high so that they're covered. And that's why pricing on an ambulance today is 50% or more higher than what it was 3 years ago. It's crazy. Um, on that point, though, over the last 6 to 7 months, we've really had a nice leveling out. We haven't been hit with any major price increases. During the peak of the crisis, we were getting hit with 4, 5, 6% increases every quarter. Historically, we were getting maybe 2 or 3% a year. So that was obviously a big shock to us and all of our customers. But I will say over the last 6, 7 months, things are really leveling out. We're getting back to how it used to be. Still at that high price point. It didn't go down, but it's just not going up at the same rate it was.
Yeah. Yeah. Rarely do the prices ever come down once they get up. But hopefully it'll stabilize. So you're close to the manufacturing side of it as far as the main dealers like Ford, Dodge, Chevy, things like that. Um, so what have you seen as far as manufacturing trends where the chassis are being built in other countries and then there's either an increase or a decrease when they're shipped over here? And then what do you see as far as I saw something the other day that showed that Toyota was selling almost twice as many vehicles than Ford. So do you
Right.
think there's a future in there where we're going to be driving a Toyota ambulance?
Could be. I mean, so Ford's been the dominant player in the ambulance market for quite a while, whether that's with their F series on the Type 1s like you use, the Transit on the Type 2s also like you use, and then they have the E series for Type 3s, which a lot of customers use as kind of a blend between a Type 1 and a 2. I'd say probably still 80 to 85% of the ambulances that we sell and that our manufacturers build are on Ford chassis. Um, there was a trend towards Dodge. There's some Chevy options out there that are pretty decent, but Ford for the longest time has just been the biggest supplier of ambulance prep chassis. Ambulance prep is what the code you have to order the chassis with to get a few items that we need to build on it. Um, and then there was a trend towards Mercedes a few years back. There was quite a few of them actually, even in Missouri, that were on that Mercedes chassis, and some that still use them. Most have gone away from that because while the Fords are some major components are built in America, the Rams are built in Mexico, the Mercedes were built in Germany and shipped across the ocean. So obviously pretty cost absorbent with that. But as it stands now, it's really only those four that build on a chassis that we can use for an ambulance. Toyota doesn't build a cutaway that we can use, at least in the US. Eventually we'll get to that point, maybe. And I can tell you that really what drives us from the dealer perspective or our manufacturers is what does the customer want. You know, if Toyota came out with a cutaway chassis and there was enough customers that said, I'd like to try that out, then we build on it. You know, that's kind of how we
Market drives it, that's for sure.
Right. Right.
In another life, I worked at a factory for a General Motors supplier, and so we were always getting updates as far as the status of the market. And around that time, I think Toyota had built a plant down in Tennessee that I assume is still there, and they had showed that the percentage of U.S. made parts was higher on the Toyota vehicle that was built in the U.S. than some of the Fords.
Right.
Their manufacturing was where they put everything together was in the U.S., but a lot of the components were coming from overseas.
Right.
So you had mentioned something earlier. Let's see if I got. So as you know, living in Missouri, everybody knows that we have a manufacturer here in the state that makes ambulances.
Mm-hmm.
How do you coordinate or communicate with your competition? And are you guys is it friendly competition, kind of like car salesmen, or you guys get along well?
Yeah.
Good.
Yeah, we do. The manufacturer in the state, they're really good people. They build pretty solid trucks. They're on the smaller side when it comes into, you know, manufacturing capacity. So they're very regionalized here. They have a lot of customers, of course. They're built, you know, right in the backyard. They're 45 minutes from me. And they're good people. So it's all friendly competition. So what's always funny when I talk to people, especially outside the industry who don't know, is that when I'm competing for deals with new customers, I'm really running across the same two competitors every single time.
Mm-hmm.
It makes the wins really great, and it makes the losses fun because you can poke fun at each other and all that other stuff. So it's fun. Still competitive, but you know who you're competing against, which makes it nice.
Yeah, I really enjoyed that. Rising tide raises all ships, so to speak. So.
Yeah. Yep.
We've got a Missouri Ambulance Association conference coming up here in just a few weeks down in Lake of the Ozarks. Do you guys plan on being there?
Definitely. Yeah, we're big supporters of the MA.
Good.
Yeah, their meetings at the lake, is it 2 or 3 they do every year?
Yeah, typically we do 2 through the Missouri Ambulance Association, and then there's the big expo, which is a combination of the 3 associations.
Yeah.
What value do you find as a vendor? What value did you find in conferences?
Yeah, so we're big supporters of MAA and also, of course, MIMSA, and I know that they all tend to work together on the big state conference. But you know, we take those as an opportunity, really to see our customers. You know, when we're working with them on a deal, we're talking to them quite often. But a lot of our customers in the state are smaller agencies. They might buy a truck every 2 or 3 years, so I'm not necessarily going to get to see them every single year if I don't drive by their place and happen to stop in. So the MAA meetings, and then of course the Missouri EMS conference is a great opportunity for us where all of our customers are going to be in one spot at the same time, and we get to say hi, shake hands, all that other stuff. Of course, if someone's interested in the truck, that's great, but most of what we use it for is our current customers, and you know, staying in front of them, making sure they're taken care of from our perspective.
We sure do enjoy it. I think the networking is probably the most powerful part of conferencing. So then you get to put a name with a face, and it just makes the already small world of EMS even smaller.
Right.
You have this wonderful network of people to reach out to with pretty much any subject that comes up. You can think of somebody who's a subject matter expert that you can give a call to. Say,
right.
Hey, what do you think about this?
Yeah. Yep.
So I mentioned earlier you're an EMT. Are you
Mhm.
still working on the truck anywhere?
I'm still carried with Slater. It's been a little while since I've been there.
Yeah.
The Pinnacle side of things tends to take up a lot of my time, and so where I used to spend, a couple weekends a month there, it's a little bit less now. But yeah, still really involved there.
I just talked to your administrator this morning. He seems to be doing well.
Yeah,
I think he's
yeah,
going to be transitioning over to law enforcement here pretty soon too, right?
yeah. Over in Randolph County.
It's exciting.
Mhm.
Very excited for him. He's a good person.
Very good.
Enjoyed talking to him. So, if you had a magic wand today and you could change anything in EMS, what do you think it would be? What do you think is the biggest challenge that we face?
Um, I think the one unique part of EMS as part of the larger healthcare that we have in the country is that um, any other time that you are working with a patient, whether it be in a hospital or a clinic or an eye doctor, even, um, you're going to get paid, whether it's by that patient directly or by their insurance. EMS is one of those things that's so interesting because you never really know.
Mhm.
Whenever someone calls 911, you have to go and you have to treat them, not knowing whether you're going to get reimbursed or not. So I think reimbursement on the EMS side is something that I've never quite understood. um, how all of it works and why some patients pay this and some patients pay that and some patients don't pay anything at all because you just can't get anything out of them. And it's funny looking at EMS budgets, how much they have to write off because they just weren't able to collect any money from that call. When you know that they spent the fuel it took to get to the house, paying the EMT and the paramedic to go there and treat the patient, whatever medications they gave, the ride to the hospital, a lot of other stuff. So I think reimbursement on the EMS side and getting properly paid for what the work you did is something that if I could wave a wand, that would be one thing to do. And especially, MIH is something that's really grown in the last couple of years, and getting paid um, for a patient interaction when they didn't necessarily need to go to the hospital is something that I know that you're working on, and a lot of others across the state are. Um, that really interests me.
Yeah, I agree. I've only been kind of dabbling in the legislative side for the last couple of years, and it's just been fascinating to me. Didn't realize that I was going to enjoy it that much, but I think ever so slowly, the wheels of legislation are turning in favor of EMS. And I think if anything good came out of COVID, it was the ability for insurance companies and the federal government to realize, hey, these guys are smart too, and they can actually take care of a person in their home and not have to transport. And I was shocked to find out that EMS still, since its inception in the 70s, is listed in the federal procurement system as a supplier,
Right.
whereas nurses, doctors, hospitals, everyone else is listed as a provider. So the reimbursement structure schedule is completely different. And EMS, with a few exceptions, we only get paid when our wheels are turning.
Right.
We're incentivized to transport that patient to somewhere, a hospital. And then if we don't transport them to the closest hospital, then we get dinged and or insurance refuses to pay. And then the poor patient ends up getting that bill.
Hmm.
And they already pay enough for their insurance premiums. And then I have several conversations on a regular basis with insurance companies that are frustrated because we're not in network with them.
Right.
And a lot of public EMS agencies that are tax based, they're not going to be in a preferred provider status with any insurance. So the conversation is at least started at the federal level, and I think MIH is a big driver of that because insurance companies see the reduction in their costs being significant if we can really get that thing going. And I use the example of a diabetic patient. You have a non-compliant type 2 diabetic that just loves their lifestyle and they're not willing to change. They end up not managing their blood sugar and they end up with a diabetic wound. They have to go down and get that taken care of. They come back home after surgery. They don't take care of their wound. It gets infected again. Then they're septic and then they're back in the ICU for another week. And then it's this big revolving door. Whereas if you could have a community paramedic monitor their A1C and draw blood and coach them on nutrition, the condition of their home, and reducing hazards inside the home so they don't fall or they don't bump their feet and cut them. Just little stuff like that with the oversight of a physician could really, really reduce the overall cost for just that one patient type.
Right.
And then there's just numerous other conditions that it could be beneficial for.
Right.
I'm hopeful that that's going to change in my lifetime. I'd really like to see it because there's so many agencies in just our state, in our local area, that are struggling. There's threats of them closing down. We have agencies nearby us with friends that I know that they can't staff a truck. They don't have any employees to staff a truck, or they don't have any paramedics. They have to put a BLS truck together. It's better than nothing, and then they have to rely on mutual aid from their neighbors, which then we all love to help each other. But when it becomes an ongoing thing and it's something that's just expected, then it becomes a strain on that assisting agency that sometimes isn't sustainable.
Right.
And, you could take a risk of going back to the voters and ask for more tax money, but that's never a good conversation. So
Yeah.
nobody wants to pay more taxes, myself included. So it really is it's a multifaceted problem that I don't think is going to quickly go away. But
Yeah.
again, at least in Missouri, we're having that conversation, and at a national level, we've got at least part of the conversation started and moving with bills they're passing pretty quickly. So
It's awesome.
it's exciting times. Are you comfortable talking about your wife's profession? I think it
Yeah.
pertains. So go ahead and tell the audience what your wife does and what
Yeah.
she's for.
Yeah, so my wife is currently in pharmacy school. She's a P3, so that means it's in her last year of actually going to class every single day. And she spends about half her time in class, half her time working either in clinics in Columbia or also in Fayette. Actually, she spends a lot of time there. Next year, she'll be a P4. In your P4 year of pharmacy school, you go on 9 1 month long rotations at different pharmacies, and there's a lot of criteria for what those pharmacies has to be. So some are hospital based, some have to be rural, some have to be more commercial, like a Walmart or a Walgreens. Some have to be admin side. So next year she spends basically her whole time working and paying to work, which that's not unique to her profession. Anyone who's paramedic's done that. So yeah, she's a couple years away from being a pharmacist, and we're real excited for whenever she gets done.
That's exciting. Now, you guys are probably going to want to be closer to family after she's done with school, right?
Yeah.
Yeah.
Yep.
Good. Well, that's
Yeah.
exciting. So has she been exposed to anything in her training or her schooling, just with the conversation centered around big pharma and kind of the drug industry driving healthcare in a lot of ways?
Yeah, definitely. So she works at 2 different places right now, part time. She works at a Walmart pharmacy and has for going on 5 years now in Columbia. And then she also works at the Veterans Hospital here in Columbia. And those are really two different things.
Mhm.
The Veterans Hospital is almost unique in and of itself because the patients really aren't paying anything most of the time. That's really different than most hospitals.
Mhm.
But specifically at the Walmart pharmacy, there's always the balance of what's best for the patient and what's going to make Walmart profitable. A lot of people own Walmart stock, and the pharmacy is a big part of that. It's interesting when I talk to her about it. She talks a lot about how some drugs are really just come here. Let me, whether that's regular cold and flu or birth control or anything that's kind of more of a common thing that people are going to get that are not high profit products for them. They're really there to get them inside the store and then go buy your groceries here, and that's how they're going to make their money on it.
Mhm.
The part that she always tells me they do make their money on is shots, and that doesn't really matter what it's for. Flu shots, COVID shots, shingles, all that stuff that they push.
Mhm.
Um, that's tends to be where their profit points are at, and so that's why they are always. If you've been to a Walmart pharmacy, probably they're going to ask you, "Have you had your flu shot this year?" And they're going to be willing to give one to you right then if you haven't, which is interesting. And usually it doesn't cost anything for the people who are getting the shots, but they'll run your insurance and then make their money off of it that way. So it is interesting because really one segment of it with the VA is really patient driven. That's really the only thing that's driving it. And then the Walmart side is it's a balance of patient and profit driven. So there's positives and negatives, of course, to each of those, but that's something I found interesting.
She probably wasn't exposed to it back when I was, but one thing that my wife and I had been discussing is that the vaccine schedule for children has jumped, it's tripled since, we were in school,
Mhm.
and really tripled in the last 15 years. And the way that they're making them has also changed. We just went to a local pharmacy the other day for a lady who went into anaphylaxis right after a shot.
Mhm.
I think it was a flu shot, and the pharmacist did exactly what he was supposed to do, saved her life, and then we monitored her and transported her to the hospital. But um, he said, I don't know what happened. I've given that lady a flu shot every year for the last 15 years, and now she's having a reaction to it. So
Right.
it's worrisome, especially we've got a 2-year old, so she's going to be getting ready for school soon, and we got some hard choices in the future, I think.
Definitely. Definitely.
Well, I know that I told you only 30 minutes and we kind of went over that. Out of respect for your time, I will go ahead and bring it to an end. I really do appreciate you being on here. And as this kind of evolves and get a bit better at it, maybe we'll get a chance to invite you back. And
Definitely.
if you wouldn't mind, just kind of spread the word. And if you find value in it, feel free to share it. I'll send you the link, and it's on all major podcasting platforms out there: Spotify, Apple Podcasts, YouTube. So hopefully you find some value in it. It sure was good talking to you, and it was easy. It just flowed. It doesn't seem like work talking to you, so I appreciate
Yeah.
it.
Yeah. That's always how the best conversations go, not following a guideline, just letting nature take its course, and appreciate your time.
Absolutely. Well, thank you very much, Mr. Kade Jarvis with Pinnacle Ambulance, and I look forward to seeing you next week.
Yeah. We'll see you then. Thanks.
All right, take care.